Hi, when I have to tell about myself, my name is Benita. I am an advanced practice nurse student. I did my associated degree of nursing from back my country, Nepal, in 2009, and worked there as an RN from 2010 till 2015. And also I did my BSN back in my country, Nepal, in 2012. I came to United States in 2015. I got my nursing license here in 2016, and I started working as an RN from 2016 in United States. And I have worked in a nursing home. I worked nursing home for 2 years, and I worked in a hospital in rehab unit for 1 year, and I worked in a dialysis clinic for 2 years, and I'm working in a doctor's office. I also did my BSN here from Grand Canyon University, and currently I'm doing advanced practice nurse from Youngstown State University. So I have another question. Describe your APRN position, including specialty. So APRNs include a nurse practitioners, clinical nurse specialty, a nurse anesthetist, and a nurse midwives. So all play important role in healthcare, and they have their own specialty. And I'm currently a student doing a family nurse practitioner course. So family nurse practitioner completes additional training in primary care settings of all patients, all age patients, and FNP expertise to diagnose, monitor, and treat sick people of all ages. So I have another question. Do you see an APRN influence in today's healthcare system? If so, how? If not, why? So I see APRNs have played major roles in today's healthcare system. They are prepared through advanced education, training, and are expected to handle the task regardless of their specialty. They are expected to to examine a patient, so where they collect information from patient families. They perform physical examination, order diagnostic tests, interpret the results. They also make a diagnosis. They are able to make a diagnose a patient on their own, and they are able to develop a treatment plan and prescribe medication depending on their state's law. And APRNs are able to provide high quality care to patients with cost effective services, and they are focused on health promotion, disease prevention, health education, counseling, and they are excellent instructor both for their patients and for other medical professionals. And with the impending rise in the demand of health services, APRNs has played major role in today's healthcare system and are the great source of health care for millions of people. APRNs are able to make a difference in patients' health and lifestyle utilizing their knowledge and skills. And also, research has demonstrated that APRNs are able to deliver a high quality care to patients. With increase in the number of APRNs, people in United States have easy access to their primary care provider that and lead to a better patient's outcome. And patients are able to get care without any delay. They don't have to wait for the physician for a long time. So I have the other question. What are some of the barriers that APRNs face? So APRN are still facing a number of challenges during their practice, which are like variation among the 50 states with respect to a scope of a practice, prescriptive authority, and collaborative practice requirement. So APRN in some states are not allowed to write a prescription of some medication, and although they are allowed to diagnose and treat the patients, they have to wait for a physician to sign, which can delay in the treatment and inconvenient to work. So they have to wait for physician to sign documents such as disabled parking placards, a referral for physical therapy, or death certificates, and some aren't even allowed to refer. In some states, they are not allowed to refer patients to specialists. So which results in delay of care for the patients, especially when physicians are not available in a clinic, or like when they are not available inside. It makes the delay in a care for the patient. That can be overwhelming to both the patients and APRNs. And there is also a title variation for APRNs from state to state, that like they have adopted a title, different title in different states for APRNs, including like nurse practitioner, which they call NP, advanced nurse practitioner, and they title as ANP, clinical nurse practitioner, they say just CNP, registered nurse practitioner, which they call RNP, etc. So which with this inconsistency in the title, that has made the public confused about the role of the APRN, what does they do, what is their job description is, with the variation in the title, so they get confused. So these are the barriers for APRN they are facing. So what changes, I have other question, what changes would you like to see made for APRNs? So APRN must be allowed to practice to their full extent based on their education, and clinical preparation. I would like to see APRNs able to practice freely in all states without any restriction. The variation on state to state for scope of a practice should be omitted, and they should be allowed to practice in each and every state without any restriction based on their licensure, accreditation, certification, and education. And if these barriers are removed, the delay in care due to these barriers will be eliminated, and clinician will be able to meet the patient's need and provide a high quality care. And APRNs are able to fill the gaps on patient's care that patient has to wait for so long because due to increase in the physician shortage. So APRNs will be able to fill that gap. They can provide patient care. They will be easily the patient will be easily accessible to their primary care provider through APRNs. And also APRNs must be acknowledgeable for APRNs must be acknowledged as full partners with physicians and other healthcare professionals in redesigning healthcare in the United States for better health outcome. Thank you.